when you're trying to understand what's happening in the brain and how we can help the brain, the brain is made of neural pathways. It's made of cells, but it's made of pathways that connect them. It's these neural pathways in the cells on either end that really become disrupted for people with neurological issues. Same thing with body issues too. We have changes in neural pathways when we have problems in our spine and different areas of our system. But you can see here, we end up getting weaker pathways with this red pathway where information just doesn't flow as freely in the brain and as accurately. And what happens is it then also affects the body. So that information should be coming down to the body, and then that starts to affect our body control of joint position sense, muscle tension, inflammation, pain, all the things that give us symptoms neurologically or musculoskeletally in the body. So what we do as chiropractic neurologists is we go in and we figure out where these pathways, neural pathways, are dysfunctional, and we strengthen them. And we do different types of treatments that actually start to bring them back into a healthier state of function, and then improve the connection not only within the brain but between the brain and the body, which then eliminates this dysfunction in these pathways. And part of the way it does this, we do this the way that we do this is through neuroplasticity. And so if you look at these connections between these two pathways, it's really not just one connection. It's actually multiple connections we call synapses that create a healthy system. It's kind of like trees, branches of a tree. The more branches a tree has, the more leaves a tree has, the healthier it functions. So in the same way in our brain, the more branches or connections between the two parts of the brain or between our brain and our body, the healthier our brain is going to be and the healthier our body is going to be. Similarly, like a tree, and like a tree branch, we can also have injury to these, like we saw earlier with the red dotted line, where we start to reduce connections. That doesn't kill the pathway, it just weakens it. What often happens is then we form these compensatory weaker pathways that we saw through here that really don't do as good a job. Now they're able to help to some degree, but they don't do as good a job. So what we want to do, like a branch of a tree again, is we can grow these back to their normal status. And like branches of a tree, we also want to prune off the unnecessary branches that aren't helping. So what we're left with at the end is a beautiful tree or branches or pathways that then bear lots of fruit. When we have that, then we have a much healthier brain, we have a much healthier body. And when we combine treatments of the two, we have expedited relief and healing. We're able to heal more difficult conditions. A lot of chronic conditions that make changes in the brain that are never addressed are reasons people still have pain. Neurological conditions, all of these things are related to these neural pathways. And again, the key is locating where the weaker neural pathways are and then targeting them specifically with treatments that can strengthen them and restore them to their normal function. That's what we do with chiropractic neurology.